The OneTouch UltraSoft 2 lancing device is designed for less pain. Getting started. This video doesn't replace your owner's booklet. Before using the OneTouch UltraSoft 2 lancing device to check your blood glucose, carefully read the owner's booklet and inserts that come with the components of the system. To reduce the chance of infection and disease spread by blood, wash your hands thoroughly with warm soapy water before checking. Rinse and dry completely. The lancing device is intended for a single user. Never share a lancet or lancing device with anyone, including family members or multiple people with diabetes. To insert a new sterile lancet into your OneTouch UltraSoft 2 lancing device, first, remove the cap by twisting off the end cap of the lancing device. Keep the cap to one side as you'll need it again in a minute. Align the lancet as shown here so that the lancet fits into the lancet holder. Push the lancet into the device until it snaps into place and is fully seated in the holder. Remember to use a new sterile lancet each time you obtain a blood sample. This will help prevent infection and reduce pain. Twist the protective cover one full turn until it separates from the lancet. Save the protective cover for lancet removal and disposal. Place the cap onto the device. Twist the cap in to secure it. The 9 depth settings on the OneTouch UltraSoft 2 lancing device allow you to personalize sampling for your comfort. Just turn the depth wheel to your desired setting. Try a shallower setting first and increase the depth until you find the one deep enough to get a blood sample of the proper size. To be sure the OneTouch UltraSoft 2 lancing device is cocked, gently pull the priming barrel until a click is heard. If it does not click, it may already have been cocked when you inserted the lancet. Hold the OneTouch UltraSoft 2 lancing device firmly against the side of your finger. When you're ready, press the green trigger button to puncture your finger. Remove the lancing device from your finger. The OneTouch UltraSoft 2 lancing device incorporates soft stop control technology for reduced vibration for smoother lancing. Choose a different puncture site each time you check. Repeated punctures in the same spot may cause soreness and calluses. Then, gently squeeze and/or massage your fingertip until a round droplet of blood forms, like this. If the blood smears or runs, do not use that sample. Dry the area and gently squeeze another drop of blood or puncture a new site. Now, you can apply the blood drop to the test strip in your meter. When checking is complete, remove the cap by rotating it and then pulling it straight off the device, just like before. Remember your protective lancet cover? Before removing the lancet, place the lancet protective cover on a hard surface. Then push the lancet tip into the cupped side of the cover. It is easy to dispose of the lancet after using the OneTouch UltraSoft 2 lancing device. Eject the lancet by pushing the slider forward until the lancet comes out of the device. If the lancet fails to eject properly, cock the device, then push the slider control forward until the lancet comes out. Finally, replace the cap on the OneTouch UltraSoft 2 lancing device. Turn the cap or push the cap straight in to secure it. Discard the used lancet and test strip carefully after each use to avoid unintended lancet stick injuries. Used lancets and test strips may be considered biohazardous waste in your area. Want to know more? Visit online, send an email, or call today. OneTouch.